Bulawaraka and good afternoon to members of the media. So as you've heard, we are going through a rainy season after a natural disaster. So in addition to protection that we should be employing in this time, we should also be conscious of the potential for disease outbreak. And we've talked before about LTDD. L is Leptospirosis, T is Typhoid fever, D for Dengue fever, and the other D is for diarrheal disease. As you may be aware that with the leadership of the commissioners in the division, there is a program going out in all our communities on cleanup campaign and the disaster response. And you would have noticed that the members of various ministries in government are working hand in hand in this cleanup and vector reduction program. And we thank the divisional commissioners for the work and the teams in the divisions, and we're requesting members of the community to support this work as they go out into the villages and the settlements and around the townships to do cleanup during this time. Leptospirosis is a bacterial disease that's spread by animals, and it's the bacteria is carried in the feces and in the urine of these animals. It could be farm animals, they could be domestic animals, they could be rodents. And during flooding, during heavy rains, the bacteria that's carried out in the feces and the urine get collected in pools of water, and that's where humans get the infection from. So our advice is during this time we ensure that we don't swim or play in flooded water, in pools of water, because these are the areas that you can get the infection for leptospirosis. I know that our children love to play out in the rain in the pools of water and even in flooded places and drains, but this is a very risky behavior at this time, and we should ensure that in particular when we are around animals, whether they are farm animals like cows and horses, domestic animals like cats and dogs, and even rodents like rats, that we should be extra careful, and we advise our children to avoid this behavior. If we have to go out, make sure wounds and cuts are looked after and wrapped and cleaned, and we wear proper footwear. We've talked about gumboots before. They are very good for this time. Gloves and just the protective equipment and clothes to ensure that we don't get this disease. If someone's sick in the family, our recommendation is to seek health assistance immediately. Typhoid is again a bacterial disease that's transmitted through the fecal-oral route. So hand hygiene is very important. This is the time that we should, as we've stated before, wash our hands with soap and water for 20 seconds regularly and as frequently as we can. Same message we've used in measles and COVID-19. So you can see when we maintain hand hygiene, a lot of diseases are prevented. Ensure that food is well cooked and covered. We talk about the 2 and 4 hours. 2 hours, eat the cooked food within 2 hours, and if you keep food for more than 4 hours without getting it refrigerated, it should be disposed. And ensure that as you visit the toilet or before you eat, make sure you wash your hands. This is important because this particular fever, typhoid fever, is carried through the fecal oral route. Again, if someone's sick, is showing any symptoms of being sick, they should be presented to a hospital or nearby health facility straight away. Very similar message for diarrheal disease. A lot of diarrheal disease are carried, the organisms are carried through food or water. So we should, again, practice proper hand hygiene at this time, as well as ensure that the water that we keep, particularly during these rainy seasons where water supply may be disturbed, that drinking water is boiled, that we look after any stored water that we may have or use at home, and just ensure that all of this are kept clean and safe for use. Dengue fever is, as you know, a virus carried by mosquito. Usually after rains, we get pools of water all over the place, in particular around the house. The mosquito that carries dengue fever lives around the house. So make sure that the opportunity for water to collect around the house is minimized. So bottles, tires, cans, flower vase, water tanks, and tree trunks near the house, in the community, and the environment close to the house, that these are disposed or buried off to minimize the chances of mosquito proliferating and spreading. Then on to a brief update on COVID-19. So today is day 51 from our first case, and it's day 20 from our 18th case. We to date have not recorded any new cases, so we remain with 18 cases. 14 of the 18 cases have recovered completely and are back at home, and 4 are considered active case and they remain in our isolation facilities. They are currently stable in the isolation facility and looked after by our health team. We've completed a total of 1,490 tests to date, and the testing continues at our Fiji CDC facility in Tamavua. 3 of the 4 cases are in Navua isolation facility, and 1 is in Lautoka. The close contacts of these patients have been cleared, and they now have been discharged to their homes. We continue with our quarantine effort. Our quarantine enforcement team are working constantly, looking at those who are in quarantine. We have 117 individuals in our quarantine facility in Nandi, the 4 hotels that are designated as government quarantine facility, and they are on various days, number of days, and as per our protocol, they'll be tested at the 14th day, and if they are negative, they'll be sent home to complete their quarantine period there. So far, none of them have showed symptoms, and those who have been discharged continually followed up by our health team in the division. Our fever clinic continues, both the fixed and the mobile fever clinics. As you know, we have 40 fixed clinics around the country, and they are seeing a lot of patients who come in with fever, which is good. So we'd like to see a lot more people continue to use our fever clinic. Our mobile clinics are also continuing throughout the country. In the last 24 hours, a total of 22,665 people were seen by our mobile clinic. And to date, we've seen our mobile, together with our fixed fever clinic, a total of 700 and 47,359 individuals in Fiji have already been assessed by our fever clinic team. That's about 85% of the population. So we acknowledge and thank all the communities that have allowed our team to come in and have responded positively. And this has greatly facilitated our effort in surveilling the disease in the community and ensure that COVID-19 is not in the community at this stage. Our isolation facilities in the division remains available and ready, and we continue with our lockdown approach. As you know, the Vunitangi settlement in Rakete in Maduata is now on day 22 of the lockdown, so there are 6 more days. I'm sure they're looking forward to the end of the 28 days. We are looking forward to the end of the 28 days. And we're thankful to all members of the community that have gone out to this settlement, this community, have supported them in many ways. And we are thankful also for the team from the North, Commissioner Northern and his team, who've regularly visit the families in the Vunitangi settlement and have supported them all the way. And this is the 22nd day. Our COVID helpline, number 158, continues to be used by the community. We continue to receive up to 200 calls a day. To date, we've received 9,320 calls. A lot of people are using it for asking questions on fever, the fever clinics, the quarantine, and our programs in social distancing and mass gathering, and this is really good. And we'd like people who have questions about COVID-19 or related issues to continue to call this number. I'd like to bring this to a close by acknowledging the support from the community. Throughout this time, we've seen a lot of support from the community towards our strategies and our response to COVID-19. And we are thankful for all those who've, in their various ways, showed their support and appreciation. Donation of food, just visiting and say hello and thank you, and people bringing refreshments for our teams who are on the ground. We are very grateful, and we'd like to say thank you very much, Vinaka Wakalevu, to the members of the community who are supporting the work that we do. We've seen a lot of donations in the last few days, as you would have seen in the media. We've received donations from the Chinese government, the Chinese community in Fiji, and many others. And we'd like to say thank you for the support as we continue to work together towards eradicating COVID-19 in Fiji. To conclude, our 3 main messages. 1, social distancing is the medicine for COVID-19. So ensure we maintain social distancing or physical distancing wherever we are, in whatever situation we are in, whether you are out in the community, out in the shops, in the car, in the bus, wherever you are. Social distancing is the way to stop the spread of this disease. Continue to practice good personal hygiene, hand washing for 20 seconds a day with soap and water. Use alcohol hand gel if you have access to this. And when you cough or sneeze, use a tissue and immediately discard the tissue. Or if it creeps up on you and you are unprepared, then use the bend of your elbow to sneeze or to cough. And lastly, if you are interviewed by a health official or a member of our response team, please don't withhold the truth. Tell the truth, be honest, tell your story. Each detail of your story is important as we try and combat this disease. Thank you very much.